Hey guys, Dr. Z here. I'm a little bit concerned about community measures not being taken to decrease the spread of the virus. It seems to me that at this point, the authorities' effort is in confronting the rise of need that there's going to be in terms of mechanical ventilation and ICU care, but we are still in good time of preventing spread. What did the countries that prevented the spread do? They did four things. They did massive testing that at this point appears to be not available in the US. They did fever screening across large parts of the population. They did contact tracing and they did intense quarantining. Even though the first thing is not available to us, the latter three are. So let's talk about how we can incorporate those into the community. It seems to me that it's going to be the community at a grassroots level that is going to have to really empower themselves to stop the spread of this virus. I don't want to see over 2 million Americans die. But if we keep waiting for the government to rescue us, I am afraid those will be the numbers we're going to reach. The first thing that we can implement, stricter quarantine rules for certain individuals. Why? Because we know through the Chinese data that the majority of transmission of coronavirus happens in family clusters. So it might not be enough for you to be at home with your other 2, 3, 4, 6 loved ones, just waiting for one of you to give the disease to everybody else. Remember, those who are frail have a strong risk of dying, and even healthy people will go through the devastating course of a pneumonia by COVID with the possible need for mechanical ventilation and all of the aftermath of that huge damage to your body. Don't expose the whole family system. Who should be in strict quarantine in the household? If you have detected a fever over 99.5 Fahrenheit, if you have symptoms of a cold, which is safe to assume nowadays it could be COVID. So if you have a runny nose, if you have nasal congestion, if you have cough, if you have shortness of breath, any of the above symptoms makes you a potential case for COVID-19, and you should start thinking about strict quarantine. If you have had a close contact with anybody who is now reporting cold symptoms, a fever, or is a confirmed case of COVID-19, and I know that this can be controversial, but again, I'm just quoting the things that worked in China. If you're a healthcare worker, especially if you're a healthcare worker who's at the front lines of COVID-19 care, or if you're potentially exposed, so if you're an emergency department healthcare worker, or you work with EMS, or you're in a primary care setting, or you're in an ER setting, these are all scenarios in which you will be exposed, and consider what behavior you should be holding when you come back to your family. So what kind of behaviors should be in line for somebody under more strict quarantine? Those people should not leave the home, not for any essentials. The only reason why they should be leaving their homes is to seek emergent medical care if they believe the course of their coronavirus infection is severe and potentially in need for hospitalization and ICU care. Watch my video on when to seek medical care so you know that particular moment. If people under strict quarantine are not living alone, they should keep distance from everybody else in their household. Ideally, they should have their own room and their own bathroom. Understandably, in New York City, that's tremendously hard, but then these people have to establish 6 feet of distance from every single loved one. They should hopefully stay in their own space. The bathroom should be cleaned with bleach or 60% alcohol after every use. They should be very careful with their toothbrush, their cutlery, their tissues, any other kind of infective conduit, which should be managed only by them, or if it's going to be managed by other people from the household, then with gloves and tremendous precaution. Their linen and their clothes should not be shaken in the air so to not aerosolize the virus. So those under strict quarantine in a way are isolating themselves from the rest of the household. The second measure that we should be systematically incorporating during our basic quarantine is going to be monitoring our temperatures. It's really important for you to monitor your temperatures at least twice a day. And if you register a temperature above 99.5 Fahrenheit, then strongly consider starting stricter quarantine for yourself and distancing yourself from the rest of the family. The third thing is tracing your contacts. If you develop a fever or develop symptoms, you have to reach out to anybody that in the preceding 2 weeks you have been closer than 6 feet from for at least 15 minutes and tell them that they should consider themselves positive cases as well and start strict quarantine on their own. The fourth thing that is so crucial is community support. If we are going to invite individuals in our community to hold stricter forms of quarantine, then they need to know that they won't be discriminated because of acknowledging their COVID-19 potential status, but furthermore, that the community is going to be out there for them. If you are a neighbor and you're alone and you have a temperature of 99.5 and you don't want to expose others, and you're leaving a post-it on the elevator saying, "This is my cell phone number, I'm having fever, I need help, I don't have groceries," can the community step up and go buy the groceries for that person? If you have symptoms and you're doing the right and generous thing of intensifying your quarantine and not stepping out no matter what, the community has to step up and help you survive. And that's where we can all participate. When to potentially think about stopping strict quarantine and going back to just basic quarantine. If you have had freedom from any symptom for at least 7 days, or if it's been 14 days since your moment of potential contact and you didn't develop any symptoms, that's the time at which you can go back to being part of the family household. But until those times have been completed, you should consider yourself infectious. In controlling the spread of this virus at a household level, we might be making the most important gains in controlling the epidemic overall.